A very good evening to all of you. Today we are going to do a very important subject, though it is a short subject, but it is very scoring. At least 8 to 10 questions are expected in the NEET PG and INACT from this video. So let us begin with anesthesia. In anesthesia, the first multiple choice question is A. All indications for all are indications for one lung ventilation except, read the question carefully. The question is all are indications for one lung ventilation except A. Bronchopleural fistula, B. Massive hemorrhage in one lung, C. Video assisted thoracoscopy, D. Cardiac surgery. One lung ventilation is not required in cardiac surgery. It is required for thoracic surgery and for lung separation. What is one lung ventilation? One lung ventilation or OLV or lung isolation is frequently employed for intrathoracic surgical procedures and is also used in situations where pathology may affect one lung but not the other. Lung isolation may be accompanied by a number of methods including double lumen endotracheal tube, placement of bronchial blocker through a single lumen endobronchial tube and a single lumen endobronchial tube or advancement of single lumen endotracheal tube to an endobronchial position. Slinger describes three general categories for classification of indications for lung isolation: surgical exposure, protection of contralateral lung from injury or pathology, maintenance of continuous ventilation during the differential lung ventilation. So the correct answer here is B. Cardiac surgery. All are benefits of supraglottic airway device over endotracheal tube, except A. It is less invasive. It causes less hemodynamic alteration. C. It prevents aspiration. It requires less time for insertion. Correct answer here is it prevents aspiration. The most frequently reported malfunction in a medical gas pipeline system is A. Inadequate pressure, B. Cross connection, C. Excessive pressure, D. Alarm dysfunction. The correct answer here is A. Inadequate pressure. So the most frequently reported malfunction in medical gas pipeline system is inadequate pressure. Color of shoulder of oxygen cylinder is A. White, B. Black, C. Blue, D. Yellow. It is white, as you can see from the image here. You can join 10x Ultimate 2-day NEET PG Breakthrough Foundation. Click the link in the description box. For first 10 registration, it is free. Massive transfusion of stored blood results in A. Citric acid toxicity, B. Hypokalemia, C. Metabolic acidosis, D. Hypercalcemia. What happens in massive blood transfusion? Citric acid toxicity can occur. Gene for ryanodine receptor mutation in which responsible for malignant hyperthermia is associated with chromosome 19. First sign of accidental intraarterial injection of drug is A. Pain, B. Pallor, C. Cyanosis, D. Cordy. It is pallor. Highest concentration of oxygen is delivered through A. Nasal canal, B. Venturi mask, C. Bag and mask, D. Mask with reliever. It is bag and mask. Highest concentration of oxygen is delivered. A 20-year-old man was running on the road. He suddenly collapsed. First thing to do is A. Check the pulse, B. Chest compression, C. Call for help, D. Scene safety. First, it is scene safety is very important. A patient with stable atrial fibrillation, what treatment should be started? Stable atrial fibrillation. A. IV butylate, B. Immediate cardioversion. C. Amiodarone. D. Sotalol. It is IV booklet. Please click the link in the description box to join the 10x Ultimate 2-day Neet PG Breakthrough Foundation. Where should you attempt to perform a pulse check in a child who is anywhere from 1 year to 1? Puberty. A. Brachial artery. B. Carotid or femoral artery. C. Radial artery. D. Femoral artery. It is carotid or femoral artery. Depth of anesthesia can be best assessed by pulse oximeter, end-tidal PCO, EPG analysis, bispectral index. It is bispectral index. Most commonly used nerve for neuromuscular monitoring under asthma is A. Radial, B. Ulnar, C. Glossopharyngeal, D. Vagus. It is ulnar. Best site for core temperature monitoring during malignant hypothermia is oral, esophagus, axillary, rectum. It is esophagus. Following are methods of invasive cardiac monitoring, except the correct answer here is transthoracic echocardiogram. Ashner's reflex is by A. Cardiac surgery, B. Neurosurgery, C. Spinal anesthesia, squint surgery. It is squint surgery. All are indication of evoked potential monitoring. A. Cerebral tumor resection, brachial plexus repair, mastoid surgery, spinal fusion and instrumentation. It is mastoid surgery. A heavy smoker when posted for elective surgery would be most benefited smoking at least 6 to 8 weeks before surgery. During pulmonary artery catheterization, entry into pulmonary arteries is denoted by increase in systolic pressure, B. Decrease in systolic pressure. So the correct answer here is increase in diastolic pressure. Most common complication of pulmonary artery catheterization is A. Infection, B. Thromboembolism, C. Arrhythmia, D. It is arrhythmia. Which among the following is the best monitor to detect abnormal hemoglobin? It is CO oximeter. Plasma cholesterol is reduced in all of the following conditions: A. Pregnancy, B. Liver disease, C. Malnutrition, D. Hemolysis. Is exactly hemolysis. Which of the following is not a complication of succinylcholine? A. Increased IOP, B. Increased ICP, C. Increased BP, D. Increased heart rate. Okay, it is increased BP. Water content of soda lime is it is 15%.